Every mother deserves the right and the opportunity to truly understand breastfeeding. Today, I want to highlight the emotional struggles many postpartum women face, especially those who are deeply committed to breastfeeding and don't consider any other options. When things don't go as planned, the pressure and disappointment can be overwhelming. This can lead some mothers to stop breastfeeding due to the distress, which, if unaddressed, may develop into mood disorders like anxiety or depression. I know that 10 minutes isn't enough to explore this topic fully, but my aim is to remind you that most challenges can be overcome and support is available to help you stay focused on your breastfeeding journey. Breastfeeding offers numerous advantages for both mother and baby. Breast milk contains antibodies that help protect the baby against illnesses like infections and sudden infant death syndrome, also known as SIDS. Also, it is highly absorbable and contributes to better brain and cognitive development, supporting the baby's healthy weight gain. Maternal benefits range from lowering risks of breast and ovarian cancers, high blood pressure, and type 2 diabetes. It helps burn extra calories, aiding in desired post-pregnancy weight loss. Most importantly, breastfeeding releases oxytocin and prolactin, hormones that promote maternal attachment, reduce stress, and enhance psychological well-being. This hormonal interplay fosters a strong emotional connection between mother and baby. In summary, breastfeeding is the most suitable, natural, and effective way to support your baby's development and your own health. The first days after birth bring many changes. It's normal for newborns to lose up to 10% of their body weight, which is usually regained within 2 weeks under medical supervision. Breastfeeding begins with recognizing early hunger cues, like rooting or hand sucking, before crying. Prompt response and a good latch support effective feeding and help maintain milk supply. Challenges like poor latch can affect milk transfer and cause painful nipple damage, making breastfeeding emotionally tough. If not addressed, it may lead to engorgement or mastitis, a painful inflammation that may need medical care. Even dedicated mothers may worry about milk supply, particularly without support. This can lead to early formula use, which reduces breastfeeding frequency and may lower milk production. Efficient pumping can help maintain supply, but it requires effort, like pumping every 2 to 3 hours, cleaning equipment, and balancing recovery. Done inconsistently or incorrectly, it can cause frustration and unintentional formula use. Some mothers eventually turn to formula to supplement their milk. This is a valid option, but if exclusive breastfeeding was your plan, it can bring feelings of disappointment or guilt. In the early days, when breastfeeding becomes difficult, like issues with positioning, latching, low supply, or pain, it can lead to feelings of helplessness, frustration, and guilt for not meeting personal expectations. The reluctant switch to formula, especially if it happens suddenly, triggers negative feelings. Studies like the one by Starretts and colleagues in 2023 show that this can cause real emotional distress for moms. Feeling powerless if feeding doesn't unfold as planned can affect early bonding with their baby, and it leads to deeper emotional challenges. Although these feelings doesn't mean you failed, being aware of these possible struggles now means you can feel more prepared and know when to ask for support. When breastfeeding is deeply tied to a mother's sense of identity and her vision of motherhood, difficulties in achieving it can have lasting emotional consequences. For these mothers, struggling to breastfeed or feeling they have failed can trigger intense feelings of guilt, inadequacy, and loss. These emotions don't always fade with time. Instead, they can linger, increasing the risk of postnatal depression and contributing to long-term mood disorders. What begins as a feeding challenge can deeply impact a mother's confidence, self-worth, and emotional well-being long after the newborn stage has passed. In Australia, most hospitals now follow the Baby Friendly Hospital Initiative, a global effort to support breastfeeding through better care and policies. As a result, 90% of babies start out breastfeeding, but by 2 months, that number drops to 74%, and by 6 months, only 38% are still breastfeeding, showing we still have a way to go. Continued breastfeeding often depends on the support mothers receive in those early days and weeks. Challenges like pain, latch issues, and exhaustion are common, and without help, many mothers stop earlier than they would hope. With the support of a trained lactation consultant and practical tools, the chances of reaching breastfeeding goals go up. For example, if there is a nipple injury, low-frequency ultrasound therapy can ease pain and speed up healing, often within just 24 hours. Most times, with early support, many mothers overcome challenges and succeed, gaining confidence, bonding more deeply, and celebrating the amazing role their body plays in their baby's growth. Early support makes a difference. During pregnancy, many mothers attend a short breastfeeding class or make a birth plan, but real preparation goes a bit deeper. It helps to talk about your breastfeeding goals and any questions or concerns you have. This allows your care team to offer support that fits you. Hands-on demonstration like how to use a breast pump can be really helpful. You will learn how to adjust the settings and recognize when your milk is starting to flow, which can make expressing milk much easier later on. Talking to a breastfeeding counselor can also be useful. They can help you set realistic expectations, check in on your emotional well-being, and guide you to helpful resources. Support groups like those from the Australian Breastfeeding Association can connect you with other moms. These groups are great for encouragement and can reduce feelings of isolation in the early days. They can also connect you with moms who did not succeed in breastfeeding, and those groups will help you cope with the frustration of not achieving your breastfeeding goals. As you prepare to meet your baby, it's natural to focus on the joy ahead. But feeding can quickly become one of your baby's most urgent needs, and in those early days can be very overwhelming. When things don't go as planned, the emotional toll can be real, sometimes leading to anxiety or postnatal depression. That's why early support is essential, whether it's guidance with latching, boosting milk supply, or simply feeling heard. The right help can make all the difference. Many resources are available online, through healthcare services, or offered free or affordably by not-for-profit organizations and community groups. You are not alone. Breastfeeding doesn't have to be perfect, and you don't have to face it alone. With support, you can find your rhythm, feel confident in your choices, and build a strong, loving bond with your baby, whatever feeding path you take.